Good evening, sir.
Hello, Shwetal Ben.
Hi.
Hi.
Hello,
Good
Lopa.
evening. We are live now, so we'll just start.
Hi, Dr. Manoj.
Yeah, hi. We are live.
Okay.
Sharanya, let's start.
Everyone. I take great pleasure in welcoming you all to the inaugural webinar of the Healthy Longevity Initiative. Under the NNF Presidential Action Plan 2025, the Lifestyle Medicine Wing was formed under the leadership of Dr. Manoj and Mrs. Pooja Manoj. And for the past few months, we've had active participation from the various members. We've had meetings to discuss how we can take this forward, this initiative forward. And after multiple meetings, Dr. Manoj and the rest of the group have come up with this inaugural webinar, which is the Healthy Longevity Initiative, the HLI. And today we'll be inaugurating this. We have with us our president, NNF president, Dr. Manoj. I welcome him, and Ms. Pooja Manoj. And this has been done as a coordinated initiative between NNF, Lifestyle Medicine Wing, and the Department of CMC Vellore as well, the Lifestyle Medicine Department. We also have with us today Dr. Lalan Bharti sir, who's the president-elect, and Dr. Somshekhar Nimbalkar, who's President-elect 2026, and our Secretary General, I think, is yet to join us. And we also have Dr. Dinesh Tomar, who's the chairperson of the this lifestyle medicine wing, and other distinguished faculty. And I extend a warm welcome to all the delegates as well. So today, as part of the inaugural session, we will have our guest lecture by Dr. Samuel George. The speaker will be introduced in a bit. And the whole purpose of this initiative, as you are all aware, is that we as doctors are at the highest risk of health related issues because of our lifestyle choices, our food choices, the long work hours, and the lack of sleep. And there have been numerous studies which have looked at, what stress does to us doctors. And sadly, I have to say that neonatologists are on top of that list among the neurosurgeons and the cardiothoracic surgeons. So this is not just for neonatologists, though this is open for all clinicians and their family members as well. And we're really happy that we could start off this initiative on a high note. So now I hand it over to Dr. Manoj to take the proceedings forward.
Respected Chief Guest, Dr. Samuel Hansdaq, Professor and Head, Department of Lifestyle Medicine and Internal Medicine, CMC Vellore. Dear colleagues, esteemed members of our doctor community and our family members. Warm greetings from National Neonatology Forum and hearty welcome to today's webinar. As some of you might be aware, lifestyle medicine is a new branch of modern medicine that focuses on looking at the root, the prevention, treatment, and even the reversal of chronic diseases through evidence-based lifestyle interventions. In fact, actually, it empowers individuals to take charge of their own health by modifying behaviors and habits that contribute to illness. NNF this year in March had launched our lifestyle medicine wing for the welfare of all its members with the CME that some of us attended. And it's also meant for our fellow doctors, healthcare workers of modern medicine and the family. Friends, we are now proud to launch today Healthy Longevity Initiative, or HLI, as it's being called, an ambitious project of lifestyle medicine wing. In this project, we aim to promote the concepts of healthy living amongst us clinicians and family, as well as amongst our patients and society through the principles of lifestyle medicine. Because we all know burnout is not a buzzword for us clinicians, it's a reality. The average lifespan of an Indian doctor is considered to be 10 years shorter than the general population. And we also know that there is quite an erosion of passion, energy, connection for the overworked doctors. We are social outcasts when it comes to social gatherings outside our circle. So this program is a bold step towards change in this regard as well, towards acknowledging that healing must extend beyond the hospital into the hearts and homes of those who heal also. We have planned monthly webinars and other programs, thankfully, under the partnership with the first medical college in this country to start an organized training course in lifestyle medicine, that is Christian Medical College, Vellore. And today's lecture by Professor Sam, the head of CMC Vellore Lifestyle Medicine, is the first lecture in this series. We have also planned diet and fitness challenges and various other activities to achieve our objectives as a group. So kindly, if you are not part of these activities and still interested, contact the NNF office or any of us if you wish to be part of this movement. Finally, let me again reiterate, friends, let lifestyle medicine wing be a space for reflection, renewal, and recommitment. To care deeply, yes, but also to care wisely, looking after our own health. As doctors, lead with empathy, live with balance, and walk the talk. I wish to thank all the members of the team behind Lifestyle Medicine, its chairman, NNF Vice President, Dr. Dinesh Tomar, and the various members who have made this project a reality today. And finally, let me also thank and congratulate all of you for being part of this movement. Thank you. Now, Amit is there? Yeah,
Yes, sir.
Dr.
Yes,
Amit.
sir.
Yeah.
Good evening, everybody. A hearty good evening from abroad. I am here on a family vacation, so but I was very eager to join this workshop, which is very close to my heart. I've been associated with Dr. Manoj before NNF through this fitness workshop itself. So it is a need of hour. And as Dr. Manoj said that intensivists have a shorter um, life, almost 10 years, as he said, which seems true because we are all very stressed out. Night calls are there. And as the patient sinks, our hearts also sink. And with that, our confidence at times is broken. And so this challenge of having good diet, good exercise is must for us, because if we are healthy, we care for our family well and we look after our patients well as well. But if we are not healthy and consequently our health makes us unhappy, then we are subdued in our happy moments with the family, and we are also subdued in the clinical care with the patients as well. So over to Dr. Manoj and his team for this wonderful initiative, which aims at keeping all of us healthy, wealthy, and wise. Thank you.
Thank you. Thank you, Dr. Amit, for those wonderful words. May I now invite Dr. Lalan Bharti, our President-elect, to say a few words.
Lalan, you're muted.
Yeah. Thank you, Dr. Saranya, respected President and Chief Guest. It is indeed an honor and privilege to be present here during the launch of this very special initiative. And I can understand that is not only that close to the heart of our beloved President, Dr. Manoj, but also very essential for all of us. My heartfelt compliments to Dr. Manoj, his better half, Pooja, our Vice President, Dr. Dinesh Tomar, the chairman for this program, and expert, and all who have worked hard to make this possible. I acknowledge with gratitude the presence of our chief guest, our own office bearers, and executive board members. Your presence really highlights the significance of this initiative, and I sincerely thanks each one of you. As everybody was saying, as a doctor, we dedicate our life for caring our patients, and often at the expense of our own health. Long working hours, stress during management of sick patient, not only affect us, but also our family too. Such type of programs definitely reminds us our well-being is very, very important. So the Healthy Longevity Initiative, as Manoj was saying, will guide us towards preventive healthcare, mental and physical fitness, balanced diet, and most important, the harmony between the family and professional life. We have already witnessed the success of the launch of our lifestyle medicine in Kochi, and there we learned that lifestyle medicine empower us not only to prevent and treat, but even reverse some of the chronic diseases. So together we heal other. Now it's time to heal ourselves. So I urge each one of you to participate and encourage our colleague and family to join in this program. I look forward to seeing the positive impact of this initiative on all of us. As a president-elect of NNF India, I can assure you that this initiative will continue in the coming year too, for the benefit of our members and their family. So with that, thank you once again for being part of this initiative and wishing you all a very happy, healthier journey ahead. Thank you.
Thank you, sir, for those encouraging words and inspiring words. May I now request Dr. Dinesh Tomar, Vice President and Chairman of the Lifestyle Medicine Wing, to say a few words.
Thank you, Saranya. Good evening, friends and respected colleagues and esteemed faculty. It's my proud privilege as the chairman of this lifestyle wing to invite you to this healthy longevity initiative, which is a joint venture of lifestyle wing of NNF and Department of Lifestyle Medicine, CMC Vellore. And we know it's a very much a part of our presidential action plan. And this concept is very close to heart of Dr. VC Manoj and Pooja Madam. We have been receiving a lot of queries and a lot of buzz was there among the delegates. So the enthusiasm among the delegates shows that everybody's understand the need, and need of course has been explained by all the learned members. As Dr. Manoj said, that we are 10 years short of what a normal person is living, in spite of being the torchbearers of health. So this is very paradoxical that we should be rather the role models. We should be having the longest life when we understand how the human body functions, but still it is very paradoxical that doctors are living shorter. So this is a very good initiative, of course. The pillars, as sir will be discussing, as we discussed in Kochi also, it focuses on diet, sleep, exercise, social connectedness, stress management, and avoidance of toxins. And all these things we very well as doctors understand, but of course, we're not able to include them in our life. So that Dr. Manoj was saying that we must walk the talk. And of course, he has a walking challenge for that, a 5K walk for the next 21 days, followed by one meal a day, so to make all of you fit. And of course, this is not just a beginning. We have many more things in pipeline, including the group activities. And finally, by God's grace, we are also planning an annual conference by the year end where we can all meet and interact. And I think that has a lot of impact on the way we can carry it all forward. So I think my advice is that you should all be very fit and be a role model, because when the patient walks into your clinic and if they see a fit doctor, you'll have much better impact on your patients. And finally, thanks Dr. Manoj, Dr. Lalan, Dr. Amit, because this is a nice initiative. It's something not very close related to neonatology, but you took it up for the well-being of your NNF members. I think it will be long remembered and cherished. Thank you, Dr. Manoj.
Thank you, Dinesh sir, for those words. And it's actually nice to see that most of the people who are speaking now are themselves very good fitness enthusiasts. So it's even more inspiring. Now, may I invite Dr. Nimbalkar, President-elect 2026, to say a few words.
Thank you, Dr. Saranya. Thank you, Dr. Manoj and Dr. Lalan, Dr. Dinesh, Dr. Lopa, and Dr. Amit for having me on. I've been, so whenever I go for conferences, usually with Dr. Bish in the morning, we'll go for a walk. He will run while I will walk. And we have been doing this for the last 4-5 years. And after Dr. Manoj came into the picture for the last few years, my have reduced. So there's definitely some influence, and activities have been going on for the last 4-5 years after a scare about almost 10 years back. So I think it's very important that doctors improve their health and lose a lot of weight. And I keep some of my residents on track, asking them to lose an X amount of weight over a period of time. Because as Dr. Dinesh mentioned, it does have an effect on patients, and it is important to be fit. Uh, I look forward that this initiative progresses, and we have a lot of fit young doctors in the future, and it is very important that we ensure that we live a longer, healthy life rather than a stressful, short life. Thank you, and back to you, Saranya. Thanks.
Thank you, sir. May I now invite Dr. Ravi Sachin, Treasurer, NNF 2025, to say a few words.
I think Ravi's network is not good. Can continue.
Okay.
Dr. Ravi.
May I now request Dr. Surendra Singh Bisht, ex-Secretary NNF, to say a few words.
Hi, Saranya. Thank you.
Hello, sir.
So I was not expecting this. I was jumping for another meeting with you in this. And thanks, Dr. VC Manoj sir. And we, as rightly said by Amit, we were in his group, we were in his team in the earlier NNF, the Now or Never Fitness. And we joined and we were jumping and we were dancing. And I have photographs which I showed when me, Amit, and Somchekar were jumping in a hotel in a conference and dancing early in the morning, 7 a.m. And Manoj was doing the same from another part of the country. And this is how we joined. I must congratulate all Dinesh Tomar, Dr. Lalan, Dr. Manoj, Dr. Pooja, especially, and everybody in NNF for taking out this absolutely new concept for doctors to take care of themselves, to heal. And Dr. Lalan has spoken so well about the healers need to heal themselves. With those words, I congratulate all of you, and I wish all the neonatologists and the doctors a good, happy, healthy life.
Thank you, sir. I think we can now move on to the next part of our webinar, which will be our talk guest lecture by Professor Samuel George. And to introduce the topic and the speaker, may I now invite Dr. Lopa Dalal and Dr. Manoj.
Thank you, Sharanya. Lopa, you first.
Thank you, Dr. Sharanya. And dear esteemed colleagues, our expert speaker today, and all the faculties of NNF. So we are now into the main topic of basic concepts of lifestyle medicine. Already people have informed about what is lifestyle medicine. But just to enumerate what WHO has given, the 6 pillars of healthy lifestyle are nutrient-rich diet, regular physical activity, adequate sleep, stress management, healthy relationship, and avoidance of substance abuses. So being a modern medicine practitioners, we are quite used to write down prescription medications whenever there are some symptoms or diseases. But being a lifestyle practitioner or the professionals who practice this, and now we are also going to learn with this series that with the small changes into the daily life and daily habits which are healthier, and rather than relying only on medications, we can do a lot of change in the lifestyle diseases, and we can prevent, we can manage, and at certain point we can reverse also. So already Dr. Manoj said that it is 10 years lifespan is reduced for the doctors compared to general population. But if we see the other parameters like obesities, normal weight obesities, hypertension, etc., then also the doctors are having a lot of prevalence of these conditions. And the physical inactivity and lifestyle risk factors are quite highly prevalent among doctors. These are the recent data in the Indian context. So I think we are going to learn going to learn about the evidence-based practices from this lecture series, and with Dr. Samuel George today in the first lecture, which are backed by scientific research, clinical trials, and consensus guidelines. And the way we pediatricians and neonatologists are used to teach our teenagers the life skills, so they are better citizens. Similarly, we also need to learn what are the healthy lifestyles, so we can take care of ourselves, our family, as well as our patients. So I think let us start with introduction by Dr. Manoj.
Friends, I have a great honor, a privilege today to introduce our chief guest and faculty, a true legend in lifestyle medicine from India, Professor Samuel George Hanstack. To introduce him customarily, Professor Sam did his MBBS and MD from Old Institute of Medical Science, Delhi. He also has an MA Sociology from Annamalai University and fellowship in medical education from University of Philadelphia. Sam also holds diploma from International Board of Lifestyle Medicine and American College of Lifestyle Medicine. He is the author of, or rather the founder of, one of the founding members of two great initiatives in our region, Indian Society of Lifestyle Medicine and Asian Society of Lifestyle Medicine. He has authored various books and published widely in various national and international journals. He is a true legend and a person I look up to. Always I respect the way he has carried his simple lifestyle and walk the talk that he professes. Sam is the professor and head of the Department of Internal Medicine and Lifestyle Medicine at Christian Medical College, Vellore. And his team, the Department of Medicine there, provides holistic care to his patients, training the medical students and residents in holistic care and conduct research in various aspects of lifestyle medicine. Incidentally, something which I also benefited, Professor Sam had developed a certification course called Postgraduate Diploma in Lifestyle Medicine through distance education and contact programs in CNC Vellore. And I'm proud to say that I was one of his students. In fact, I was the first batch of doctors who did this course. I did it along with my wife in CMC not very long ago at my old age. Professor Sam also spearheads a school health program across 200 schools in India to promote healthy lifestyle among students and the parents. And finally, he has also pioneered the development of a regional and national movement of lifestyle medicine, as you can see by the two things that I just mentioned, establishing the Indian Society of Lifestyle Medicine and the Asian Society of Lifestyle Medicine. So his bio sketch runs pages. I don't want to waste any more time. So let me invite Professor Sam for the lecture. Over to you, Sam.
Thank you, Dr. Manoj, for that very humbling introduction. I did not know that NNF was now or never fit. I think that's a very good initiative and organization you have started. Everybody did say that doctors are living 10 years later, but I see both Manoj and Pooja are actually 10 years younger than what their age is. So they still look much younger. And I think that is what lifestyle is going to promise each one of you. And I think it's very important that neonatologist, which starts a little earlier than the pediatricians, to take up lifestyle, because the key thing is to start young, catch them young. Only then you may see them actually following it. By the time they come to us as in adult medicine, most of the times the habits are formed and it's very difficult to change habit. So with those words, I would want to get into today's presentation. Um, hope you can see my slide.
Yes, sir.
Okay, sure. So, lifestyle medicine, a new era of healthcare. Really speaking, there's nothing new about lifestyle, really, and that too for a country like ours and India. In different ways, we have known it. It's just that it was never an integral part of allopathic medicine. And over the next few minutes, I would just like to run through our understanding about lifestyle medicines. I'll try to define what it means. There are a lot of things. If you type lifestyle and Google it, the first thing comes is some nice dresses and all. So there are different things that people think about when you talk about lifestyle. We'll look into different domains and pillars. As mentioned, we will look into the evidence base. That's where everything hinges when we look it as a modern medicine, and the challenges in the management of NCDs. Now, when you look at these statistics, you realize that the major four NCDs that we talk about are the cardiovascular, the cancers, the respiratory, and the diabetes, which constitutes almost 80% of all NCDs. And when you look at COVID, which span over 3 years from 1920 to 22, were one of the major killers that we came across. If you really look at the numbers, the number of deaths with COVID, it comes to about 7 million over the 3 years period. And but when you look at the cardiovascular death, that's 17.5 million every year. 7 million over 3 years, 17 million every year. We need to ask ourselves what happened? What was locked down? The entire world was locked down. Only thing that was open was the fast food. And if you want to see what it is doing is, I mean, you are selling food as heart attack. That's the recent introduction to Dubai, and people love to take it. Eating what will cause heart attack, you are openly advertising, and people enjoying. So uh, we are going through a transition. In 1990s, that's how a TV looked, and that's how we looked. In 2020s, this is how our TV looks, and this is how we look. It's time to flip the pyramid, where major input is in the tertiary care and public health is kind of a tip of the pinnacle. It's time that health promotion really becomes the major part where we should be working on. It's something that I see. I can almost see about 127 people who have joined the webinar. Kudos to Manoj and their whole team that has worked. You never get so much of excitement in lifestyle these days, and that too among health professionals. Other people are definitely much more interested in lifestyle. Doctors, we are a little far away. This is year 1948. All of us are familiar. So I'm just trying to take you through a timeline. In 1948, WHO did bring in this whole philosophy and concept of a holistic approach, physical, mental, and social well being, not merely an absence of disease. And just like to take you through a few paradigm shifts. We are all medical, from medical to health, from organ to whole person, from symptom to root cause, and from disease to well being. The first paradigm is this is where I studied, which is called All India Institute of Medical Sciences. The underline is medical sciences. Very interestingly, in the next 6 years, I worked in a place called BP Koirala Institute of Health Sciences. This is in Nepal. I mean, rarely you find health centers or medical centers called health sciences. There's something about medical and the word health. And when I came to CMC, I was very intrigued by the usage of terms. Pediatrics in CMC, they call it as child health. Psychiatry is called as mental health. Preventive and social medicine is called community health. You see, there is something about that term, if you really understand what we are talking about, so that if a patient is a pediatric patient, you know how to treat it, right? But if you're to treat as child health, you see, you can't stop at just giving some pill and sending them off. These are what I'm calling it as paradigm shift that we should first have in our mind. As that gets converted, your practice on the outside will start changing. Paradigm two was, uh, you see, WHO talked about physical, mental, and social, but you see, there are different dimensions that we can go on, from environment to occupations to financial to spiritual. All those things are what is really widening. One of our units is interested in medical anthropology. Uh, you can also look at health from even that perspective. So there are different things and areas, and it is not just limited to so the American College of Lifestyle Medicine came, and these are the 6 pillars that you'll keep hearing from different people, is what they came up with. But this is lifestyle medicines. They are passionate about lifestyle. But look at this, American Heart Association, 2010, they came up with this simple Life Simple 7, which was upgraded in 2022 to Life Essentials 8. American Heart Association has an exclusive conference which deals with only lifestyle. The last I attended in Boston, where you had almost 100 of delegates who are presenting papers of the study on the impact of lifestyle on cardiovascular disease. That's where the current modern and the mainstream medicine is moving. So if you are not aware of it, it's time to wake up. And this is a old philosophy that we are bringing in the current context. The Chinese had the yin and yang, the Ayurveda talks about pitta, kapha, and the Greek talked about different flames. Everything is all about equilibrium. And this takes us to our paradigm shift 3. We are moving from symptom to root cause. I usually ask a question: if a patient came with malaria, how would you treat it? One would say, most of us, we know, okay, give them anti-malarials. I'll say, why not treat them with paracetamol? Oh, the fever will come back again. After how much time? Pharmacology, 4 hours. So what do? Give another paracetamol after 4 hours. But how long? For lifetime. Treatment of malaria, paracetamol, Q4H for lifetime. How does it sound? We'll all laugh at it, but that's how we are treating almost every disease: diabetes, hypertension, dyslipidemia, Parkinson's, interstitial lung disease, cancers, you name it. Is there any disease apart from some infections that we actually cure? This is the perfect business model that you can ever have. Make sure you never discover a drug that cures it. You run out of business if they're cured. But if you have a disease and a model that you can keep them on. So I keep talking about insulin resistance, HbA1c. So one of my juniors said, why not just look at it? So she picked up all the patients who had an HbA1c done and an insulin resistance done. About 140 patients, in HbA1c less than 6.5, that means a good glycemic control, and we looked at the insulin resistance. What would you expect? If the glycemic control is there, what should the insulin resistance be? Logically, should be low. But we found that there was a difference of almost 60%. That means sugars are controlled, but insulin resistance is still high. What do you think the patients would behave on the long term? Will the complications be different in patients where HbA1c is controlled, but insulin resistance is not under control? Will they behave different? We don't know. But that's what we are asking a question. The root cause, if it is not addressed, do they still achieve the mortality and morbidity benefits? Those are the questions that we are challenging our lifestyle enthusiasts to start asking and looking towards. Paradigm shift 4, talking about treatment and reversal. We needed our surgeons to help us practice medicine. When medicine fellows could not know how to treat or cure diabetes, they came up to teach us how to cure diabetes, bariatric surgery. Impressive. And they said, we can cure diabetes. You guys, you are not able to cure diabetes. Lo, we are here to cure diabetes. Look at the statistics. 1995, Boris, 83% of medicines. 2004, Swedish obese subjects study, 72 to 30%. Now, 72 is within 1 year, you have people getting off medicines. By the end of 10 years, the numbers comes down. Stampede, 75, 62, 51% over 2 years, 6 years, and 12 years. Lifestyle, yeah, I mean, 2001, look ahead, 11.5. 2014, direct trial, 46%. A small numbers, about 20, showed about 70%. So essentially, the first thing is the proof of a concept. Is diabetes treatable, or is it that it has to be lifelong, that we have to take medicines? Of course, started with the surgical interventions, but even medical and lifestyle intervention does show the concept is these are reversible. All that we need to know to address the root cause. The definition of remissions, now very reluctantly the American Diabetic Associations did accept that yes, in some of the patients you may be able to get them off medicines, those who are early diagnosed mild diabetes. I had my patient who was a retired nurse, 65-year-old, on insulin and on 3 oral hypoglycemics. And I just asked her, would you like to stop your insulin? She didn't say anything on my first day. Second day, she asked me, you were saying something about insulin. I said, yes. I said, is it possible I can stop insulin? I said, I don't know. We can try it. We began the journey in 3 months. She was off her insulin, off her two medicines, and only one medicine she was left. She had a follow-up with the head of endocrinology for a follow-up, and she asked me, I have a appointment. What should I do? I said, please go. But then you have stopped my medicines. I said, let the prof see what is happening. So she went to him with her book and she came back and said, what happened? No, he looked at the book, he saw my sugars, he saw my medicines, went through all the pages. I said, what did he say? He didn't say anything. He said, please continue doing what you are doing. So you see, sometimes we are asking a very basic questions whether it is possible. The barrier in our mind is when we think it is not possible, we all stop and pause. But it's something that you have to experience it once. Many of you would have heard about the lifestyle heart trial by Dr. Dean Ornish, published in Lancet in 1990, and a 5-year follow-up published in JAMA in 1998. And small numbers, patients 28 and controls 20. And he gave his intervention. And pre and post, you could see the numbers may look a little smaller, zero point 0.1 to 1% improvement in the uh, stenotic opening, but when you calculate the amount of blood that flows with that opening is much larger than just the absolute numbers. And when you take them for a longer period, the opening still increases further. It's very interesting when you look at that graph. People without treatment, it goes up. People on treatment, it still goes up over a period of time. It's only lifestyle they showed that there was a reduction. So this was one very historical study where what was proven very clearly that even a process like atherosclerosis is reversible. So we may have different ideas and arguments about it, but the first thing to establish was, are these disease reversible? And the only thing that we saw in the study is that medicines was not able to reduce or reverse the process, lifestyle was. And so that was a landmark a study that Dr. Dean launched. But look at the list of studies right from 1938. The Harvard study, we'll be talking about it a little later. 1948 was the Framingham Heart Study. 58 was the Baltimore Longitudinal Study of Aging. 67 was the Whitehall Studies. 1970 was the Adventist Health Study. 76 was the Nurses Health Study by Harvard. And 2004 was the Blue Zone Studies. And 2007 was the Calorie Studies. So there are one of the most difficult studies are these cohort studies where you have to follow them for many, many years. But all these studies very unanimously and predictably has shown and put the writing on the wall very clear that lifestyle works almost in every disease. And so we go back to the definitions of WHO of 1948 that health is about restoring the equilibrium back. Framingham, we all are familiar. 1948, the first cohort, 1971, the offsprings, 2002, the third. So three generations being followed up over a long period of time. And this was, we all know, the first study that gave us the risk factors for cardiovascular disease. which we are all familiar with. And if you look at the Adventist Health Study, again, they followed up. These are three groups. The first one is called Adventist Mortality Study. The second is Adventist Health Study 1 and Adventist Health Study 2. So, what you find is longevity, that those who followed healthy lifestyle had a length of their life was extended to 6.2 to 3.7 among males and females. Mortality was reduced by 40 to 50% due to ischemic heart disease and cancer. If you have to prove the role of a drug, about 10 to 12%, if you can show, which is statistically significant, that's a big seller. But look at these numbers, 40 to 50%, people are still not impressed. AHS1 showed longevity 7.3 to 4.4. Low is heart disease, diabetes, cancer, including lung. And the second study showed an independent health benefit of nuts, reducing ischemic heart disease by 50%. Red meat, processed meat, reduced colorectal cancer by 30 to 40%. Longevity was related to meaning and purpose and socials and exercises. So, very key messages that we got through all these studies, which is there in our archives of our epidemiology. Harvard took over the next through their series of nurses health study 1, 2, and 3, and they followed up these nurses for about 30 to 40 years, and all of them showed the same result. What was bad was sugars and refined carbohydrate for diabetes. What was bad for heart disease were the trans fatty acid, red and processed meat. What was good for the heart was fibers and nuts. Breast cancers very strongly associated with obesity, sedentary, alcohol, and hormone therapy. What about environment? And number of studies have shown air pollutants, water pollution, noise pollutions, including noise, food additives, alcohol and tobacco, climate change, technology overuse. All of these has significant impact on our health and longevity. Social, one of the earliest study, this is even before the WHO definition came up in 1938. The name is Dr. Robert Waldinger from Harvard Universities. He started following up about 1,300 people over, this is the longest study. They have followed up for almost 70 years to see what does social connectedness do to the patients. We'll come to that. There were other studies, 1965, the Lester Breslows, and 2010, the meta-analysis. So what did the Harvard study shows? They, they took up 268 Harvard sophomores, and they also included 456 inner city Boston men. They included the spouses, children, and new generations. And they had almost 1,300 descendants that they followed over a very long period. And what were they looking at? They were looking at relationship and happiness. What they found was quality relationship is the strongest predictor of happiness and health. Loneliness is as harmful as smoking or obesity. Money and fame don't guarantee happiness. All you doctors are earning lots of money. This study, very objective study, shows doesn't guarantee happiness. Beyond basic financial stability, wealth does not significantly increase life satisfaction. Fame and career success don't necessarily lead to long-term well-being. Third, physical health and emotional well-being are linked. Healthy relationships reduce stress, which protects against heart disease and dementia. Positive mental health, optimism, gratitude, resilience leads to longer life expectancies. Ask yourself when you sit in your OPD and you talk to your patients, how optimistic, how resilient are you? Or do patients and relatives tick you off? Or are you able to deal with them very gently? I'm sure neonatologists are one of the most compassionate doctors. You have to deal with mothers and children, much unlike us when looking into adults. Lifelong learning and purpose matters. Having a sense of purpose keeps people engaged and motivated. Continuous learning, curiosity, and adaptability contribute to emotional well being. I strongly suggest you attend all the monthly sessions by Manoj and Pooja and the NNF. Social fitness is as important as physical fitness. Just like exercise keeps the body healthy, nurturing relationship keeps the mind strong. Making time for friends and loved ones is a powerful investment in a long-term health. We have 126 people who have signed up. Everybody looking forward for some connectedness, and that is very important. Really want to encourage you. Social, sorry, social relationship, and we all familiar with the term EQ, emotional quotient. Most of the companies in the West are looking for high EQs and not high IQ. One of my batchmate would say, if you want the best person in your in your company or in your hospital, be ready to bear the idiosyncrasies that these people will have. High IQ, highly idiosyncratic, cannot manage them well. Social support, social engagement are very important. Among all the lifestyle parameters, there's only one parameter which is strongly associated with longevity, and that is social engagement. Very surprising, right? We may be thinking of diet and exercise and other things. It's a social engagement which has been found as the strongest predictor for longevity. Loneliness, as I mentioned, is almost equal to smoking or obesity. And again, just repeating the same, money and fame is not equal to happiness. And stress, if you remember, Dr. Elizabeth Blackburn, she got the Nobel Prize in medicine, and her study shows that telomeres are the end of our DNA. They protect our chromosomes, which make us who we are. I did not want to just know the names of things. I really wanted to know how it all worked. This is what Elizabeth says when she got a Nobel Prize in physiology in 2009. And here is where she showed the relationship of telomere length with compared to the stress levels. And that has a significant impact on both your health and your longevity. And finally, the meaning and purpose. And if you would have heard of blue zones, this is something that Dan Buettner started as an editor of National Geography. He was curious to know where and which part of the world people live the longest and what are the characteristic feature that gives them that. And he found these places: Okinawa in Japan, Sardinia in Italy, Icaria in Greece, and Loma Linda in USA, California, and Costa Rica. And what they found is that it was a sum total of everything put together, which also had faith, which also had social connectedness, apart from their diet and exercise. So, health really has so many dimensions that hopefully, as you begin this journey, you'd start exploring each one of them one by one and see how you can optimize it. So, um, the disease, so we have different domains, and the equilibrium is what gives you health, and a disequilibrium is what causes diseases. And in a disease model, what we find, genes has got an impact independent in less than 10%, maybe less than that. Environment has an impact larger than that, but lifestyle has a larger impact on your health. So if you really are looking at having your health up, you have to look at lifestyle, because lifestyle itself changes your genetic expressions. And a lot of talks about epigenes, a lot of talk about microbiomes and lifestyle that you'll talk about. So healing is a process where you find out your balance in life across all the domains that you have. And let me tell you that healing is a complex process. It's not easy. Easy to say, eat certain things, do some exercise. It's much more complex. There are a lot of self factors people don't want to change. There are a lot of environment, physical and social factors that inhibits and be as a barrier. And of course, the time factor is always there. And among these, very important is the transcendence factor, where we can go beyond all those things. Somewhere we gives a meaning and purpose. Somewhere you get your strength and wisdom. And all those things are so very important. Changing behavior is the most difficult, but if you are able to master this part of how to help people change the behaviors, you are master of your own life, you are master of other people's life, and you can make a meaningful change in their lives. Look at the relapse rate. Healthy eating, this is within 1 year. When you only educate them, they'll relapse in their diet in 70%, exercise in 50%, smoking 90%, weight loss comes back in 80% of them. So if your intervention is only educations, this is what you're looking at. So, how do you reduce relapse? Self monitoring, peer support, coaching, cognitive behavioral therapy, smart goal setting, incentives. All these are some things that Manoj and Pooja is going to teach you over the next months of your journey, and you all will be perfect. So transcendence is where you find the meaning and purpose of your life, where you find your inner peace and well-being. You find your connections with one divine and with people around. And this is very important that you inculcate within yourself, inculcate within your patients, and your patients are children and mothers. That's where you have to focus to imbibe in them the values and moralities. And that is what may give them reasons why they should do what they need to do, what you're going to tell them. So, um, a quick thing about what we have been doing here in Christian Medical College. 2013 is when we started our wellness clinic. I had short exposures on lifestyle in US as a part of my senior training fellowship. We were instrumental in getting the Asian Society and the Indian Society, founding these societies in these years, 2018. And as Manoj said, they are the alumni. They are the proud alumni of our postgraduate diploma in lifestyle medicine. Uh, we went ahead to get our textbook, Lifestyle as Medicines. It's an amazing, you could look at. We have got a cookbook, Nourish, which has got recipes across the country. Shortly, that should be available. And so, those are some of the things that we have been able to do. And really want to thank you and thank Manoj, Pooja, and the entire NNF teams and their executives for giving me this time to share something about lifestyle.
Thank you so much, sir. That was very eye-opening for some of us. So now we are open to a short panel discussion. So I would request if you have any queries to ask the legend of lifestyle medicine in our country, Professor Sam, please do so. Please post your questions in the Q&A box. So Lopa, I think I'll start with the first question by Dr. Satyan Hemranjini. What is the social engagement? What is social engagement? Kindly elaborate.
Okay, so social is basically connecting with each other. So either we get help from people if you're living a life lonely, and when we have a need and we don't find someone, it definitely affects your health. So having a support system on one side, and second is in giving we receive. When we get involved in doing certain things, could be visiting orphanages, visiting friends, and talking to them, encouraging them, motivating them. Any kind of those activities is something that is also contributes to your health on the social domain. That domain works to contribute towards your health. So when I say social engagement, it's already looking, forming a network, and within that network, there will be giving and receiving that comes as a part of that network.
Yes, sir. I think you mean to say the reciprocity of the connection, social connection.
Absolutely. Absolutely.
Sir, there is a next question from Samir Bhide. How much time one should give to exercise daily, and should it be a rigorous exercise?
Thank you for that question. I'm sure Manoj is going to answer that question He's not going to answer. Both of them are going to make you do it. So all that we are saying is that any amount is good. That's the exercise prescription. Any amount is good. The more you are able to do it, the better it is. The recommendation is 150 minutes per week. That's roughly about 30 minutes every day. But you don't have to worry that you have to do 30 minutes of exercise. Start small. You can start off with a little aerobics for just 1 minute also if you do that. We did our previous batch assessment, and we asked them to do jumping jack for 1 minute. Most of them, they ran off their steam in 30 seconds itself. So if you are able to do for 10 or 20 seconds, you are good to go. Keep doing it, and slowly those numbers will keep increasing. Most important is to begin. And if you would have come across a book called Atomic Habits, it says make it a habit. If you do it for 30 seconds or 20 seconds also, that's good. Do it for 1 week and keep increasing it slowly over a period of time. But there are lots of things on exercise, talking about aerobic strength, balance, and flexibilities. Those are lots of things that can be covered, I'm sure, in the coming webinars. But just to tell you, please begin, start small, be consistent, and with time you should be able to increase it.
All right, so now the next question is a little bit, this is sometimes even taught as a debate, the diet debate, where now people talk about the various types of diet. With so many diet trends today, the ketogenic diet and so many other diets, how do you communicate the evidence for plant-based eating to skeptical patients, or rather skeptical doctors, I must say? And in connection with that, how important is animal protein in health, considering its availability, bioavailability, as compared to plant proteins?
So let me give a short answer to a very large question. So I was I was attending one of the American College of Lifestyle Medicine conference, and the speaker came up and he said, with regards to diet, there are more than 80 to 90% of the areas we agree. We fight over those 5 to 10%, and most of our diet discussion happens in that 5 to 10. He says, why are we fighting about it? There are more things that we agree on. So, very essentially, what we are saying over here is American College of Lifestyle Medicine has very carefully chosen the word. We call it as a plant-based diet. This is in comparison to a vegan diet. When you use the word vegan, it it consciously excludes the animal product. When you use the word plant-based diet, that means most of your diet should be plant-based. If you're not fully convinced or converted to give up complete, that's okay. At least begin by taking what is very clearly known to be healthy: fruits, vegetables, salads, nuts, all those things. We have very clear cut evidence it is good. Let's begin with that. Let's not fight whether I should take that or not. That's okay. As you get more convinced, convicted about it, and you're ready and your body is ready for it, keep taking steps over a period of time. So I would just put it at that level, just for all our understanding.
Uh, Thank you, sir, for that answer. I think by speaking plant-based or whole plant-based diet, we are excluding the processed food. So if we are speaking vegan, then it will include processed food also. Okay. Sir, next question is by Dr. Umesh Khurana, and he's asking your comments on the role of meditation.
Uh, so the very broad heading we talk about is spirituality, and spirituality is a little different than religiosity. All of us, we come from a different faith background, and we have very strong belief in the background that we come from. There's a little difference between religion and ritual versus spiritual. Sometimes we may be following ritual, but within inside, the spirituality doesn't show. I may have done my prayer, my puja, my meditations, and then the next moment I'm shouting at patients and fighting over it and scheming things. That's not really spirituality. It has to be in and out. As you get changed from within, that spirituality gives you maturity, a spiritual maturity by which you are able to handle people well. If you handle people well, you have less stress. If you have less stress, you are already getting a benefit in your health because of this psycho-social spiritual domain. So I will say that each one of you, as you are convinced and whatever helps you, please follow that and see whether it translates into your practical life. So anything that translates into your practical life to give you maturity, understanding, resilience, helping resolve conflict, and able to take the most difficult situations in a more calm and mature way, anything that helps, one should go for that.
Now, actually, let me be the devil's advocate because I see a lot of questions in that direction. So I would just start with one of those. There is a lot of talk about vegans diet being the only diet which is real healthy. But if you look at blue zones, they are predominantly non-veg. I don't think so. And what's your take on this? The blue
So,
zone.
so
Yeah.
right. Uh, uh, Even among the different groups, some of them were taking alcohol, and alcohol also comes as one of the discussions. If you look at all the studies put together, any amount of alcohol is harmful for a body. Little alcohol may have showed, even that study where it shows a little alcohol is protected to the heart, that itself has been questioned. But any amount of alcohol is harmful for our brains and contributes to various diseases, including cancers and others. So there are enough of evidences for that. Now, your question was vegan excluding.
Yeah, in blue zone, the
Yeah.
predominantly is non-vegetarian diet.
No, no, blue zone is
I
not.
am not sure whether it's
Yeah, no,
factually
no.
correct, but
The blue zone doesn't is not a non-vegetarian diet. It's mainly, again, it's a whole food diet because these are people who are living in the traditional settings, growing foods, farming and eating. Some of them do take occasional non-veg, and that's where they did as a study part, because the blue zone is a very scientific study, though it was initiated by Dan Buettner, who was an editor, but he got almost 30, 40 epidemiologists who planned the study very well, and they did the collection of these data and analyze. Now, in many of the places, they have not 100% excluded an animal product. So many of those places they were taking, but they were not taking at a very high amount, and definitely they were not taking processed meat. Very clear-cut evidences are processed meat is almost equal to a cigarette in terms of cancerogenic. So whether it's a processed meat or whether it's a processed plant, any of those, when you process it, it is harmful, and there's very good scientific evidence for that. Many of those places, Sardinia and all, if you take, they would be taking little red wine up over there, and some of those places they may take occasional fish or occasional meat. And that's why they say if you want to strictly talk about it, then you're talking about a whole food plant-based diet. So whole food is the buzzword and plant-based. So here we are not trying to be, I'm a vegan. Sorry, I don't touch it. Once one of them said, you gave that was a curd, that was dairy. Don't you know I don't take dairy? I mean, the person was very offended. So sometimes some of those are rituals that it's like a religion that I do it and I don't like others doing, not doing that. So we don't want to put that picture into mind. If you want to be scientific, then we just want to be balanced, and we should be respectful of each one of them as they begin the journey. Let them at least begin the journey. Let's talk about those things a little later in their lifestyle journey rather than, I mean, you would have lost even before you began. So I will encourage all of you to be a little gentle when people begin, and please don't get into arguments on issues which are, I mean, as I said, there are small areas that we differ. There are lots of areas that we agree. Begin with there, give everybody a time and a space, and hopefully they may come on board at some point of time.
excellent. Lopa.
Yeah. Now, sir, I will combine two questions because they both are related to the frequency of meal. So Kiran Patel is asking the role of fasting in lifestyle approach, and Rip Daman Kaur is asking for diabetics, what is better, small frequent meals or big unfrequent meal?
There
Right.
is one more added question in the same category, role of intermittent fasting. So
Sure. So you should fast at least 3 times in a day. I actually fast 3 times in a day, between breakfast and lunch, between lunch and dinner, and between dinner and breakfast. That's on a humorous tone, but essentially what we are saying is, if you go very traditionally, people have always taken twice a meal. If you go to your village and ask them how much, what is the frequency of food, they will usually say twice, and they do the most heavy work, and they have survived, and they have survived all the diseases, which the diseases is our problem. The disease is not their problem. So a lot of studies, intermittent fasting has come up, and there are different formulas and classifications of intermittent fasting. Essentially, what we are saying is, in the meals, the most important meal is breakfast. Never miss breakfast. There are independent studies which says those who took breakfast and those who did not take breakfast, the health impacts. So breakfast is the most important meal. It should be the heaviest. And the second meal, it's up to you. When do you want to take it? If you want to take 2 meals and want to space it by 8 hours or 12 hours, up to you. You can do that. The second meal can be a little lighter. And third meal, some of the people may want to skip. And those who want to still take a third meal should be the lightest and should be early, in a very broad sense, putting all the evidences together. So, in a very brief way, plan out for at least minimum 2 meals. First meal the heaviest, second meal a little less, and third meal, if you can manage without, perfect. If you cannot manage, should take it light and take it early. Don't take it late in the night. That will affect your sleep.
Any specific message, sir, for diabetics? There was a question.
Right. So all our diabetic patients are on 3 meals and 3 snacks. I mean, Pooja will say, as a dietitian, they've all been trained to do that. The problem is that when they are on medications, then the sugars going low post meals, I mean, between two long spread out meals is where the issues are. So and that's why it's very important that a physician has to be a part of all these planning, and be conscious that when you have a larger gap with those medications, there could be possibilities of hypoglycemia. But as you start working on them and the need of medicine starts coming down, the need of any small meals in between the major meals you can easily avoid. Most of our patients, we are actually asking them to take 3 meals a day. We don't introduce snacks. We focus on the usual diet that they should have enough. And we try to give them minimum medicines and try to optimize it, increase it if we feel the sugar is a little high. Because if they strictly follow it, there are good chances that they'll go into hypoglycemia. So a little fine tuning and a very important medical supervision is very, very important when we're dealing with lifestyle in patients of diabetics on medications. So that's the key thing that we really need to understand.
Thank you, sir. And before we continue further, I want to ask you how much time do you have? Because I know that you are up for another webinar after this. So what time should you wind up? Because the number of questions are too many in the question answer box, personally to me, and then a few in the chat box also. So like when do we stop? We have exceeded our time, scheduled time, but it's up to you.
I don't have a problem with time, but what I would suggest for the whole group is that I can see the headings that is coming up, and I think that's what exactly Manoj has planned out. Instead of chewing on too many things on one day and not remembering it, it is good to keep all these questions, put it for those days that you have. Anything which is very pressing that you have to know that answer before you go to sleep, or you may get an insomnia tonight if that was not answered, you can bring in those questions. Otherwise, I think, I know, those are the usual regular questions which is there. Anybody who will be speaking on diet will actually cover all of them. So I leave it to you how you feel comfortable. If you feel some very specific questions which may not fit within your schedules, you want to bring it up, I'm happy. Don't worry about my time. I'm there as long as you ask me to be there. I'm there.
Thank you, sir. Actually, I mean, as Professor Sam was saying, we have scheduled 12 lectures. I will post the tentative topics soon. So most of the finer details, if whatever, those of you who feel their questions are not answered today, please do join subsequently, because we will be covering each and every pillar of lifestyle medicine and some important aspects subsequently in the every month. We are going to have this as a monthly webinar series. One interesting question I found from Dr. Sri Sailam is something on the, I mean, of an execution level. Should insurance companies mandate lifestyle modification programs before covering expensive treatments for lifestyle medications?
That's a difficult question. So, insurance itself is it's a business, and they may have different agendas that motivates them to cover. So it all depends on, if you do lifestyle and you don't fall sick and you don't have to spend them on a stent or a CABG, they would be helpful. So very recently, after a lot of logging in America, they have got some insurance covering for um, uh, lifestyle clinic consultations. Otherwise, if you spend 1 hour with the patients and gave them a lifestyle, you could not reimburse that amount. That has happened. So a lot of practitioners there have started reimbursing for lifestyle. So that's something that has happened. I'm not sure how India they'll be moving on it, but definitely it does take time for lifestyle, and you need to monitor them over a period of time. So there's a significant amount of time, and that may need to be reimbursed. And if that is covered by an insurance, lots of people may come on board. That could be an incentive for them to come on board. So I guess I'm not sure how the insurance will move towards that directions, but we just hope that it should move in that direction.
Lopa, maybe one or two questions more. We will ask and then we will close the session. Yeah.
Yeah. So one question is about how to get the book on lifestyle as medicine. As current, it is not available on Amazon.
Or is it not on Amazon?
Yeah, Manoj IJ has asked this question. Yeah, how to get the book?
It is not available. I also checked.
Oh, you checked it? Okay. Okay, good. You've told me. I'll check with the publishers. Normally, it should be there. Usually, they should take care if it is coming down. They should print and all. But if it is not there, currently is not showing there. You typed as lifestyle as medicine, right?
Yeah, that is what he has written.
So
Lifestyle
it's not
as
showing
medicine.
there. Okay, sure. We'll check with the publishers. We'll just check on with them. I can update through Manoj regarding that.
Thank you. Future. Where do you see lifestyle medicine heading in the next 5 to 10 years, especially in the clinical practice and medical education?
I feel it is inevitable. We had to campaign a lot to get lifestyle in, but now if you go to a grocery store, what do you find being sold there? I mean, you have lots of healthy options right now. The market functions by demand and supply. They will supply what the demand is. So the way we go about is that when we educate people on what they need, if the doctor doesn't know lifestyle, and if you educate your patients on lifestyle, and when that patient goes and asks the doctor, what should I eat and what should I not eat, the doctor has to go home and start reading about it, because he doesn't want to look like a fool in front of the patient. So sometimes if we can create an environment of demand among the common people, then what happens it, everybody will have to move in that direction. So what I see is that this is going to happen, because I don't think so our traditional medicine is a solution to the current epidemic of non-communicable disease. There's no way you can do that. You look at the cost of medicines that is coming for almost every disease, is just not feasible for the government to pay, and neither the patients to be able to afford to do that. And insurances also will slowly shy away from it, because cancers and autoimmune diseases, and even look at your diabetic medications, the new ones, all of them are just very, very expensive.
Lopa.
Yeah. One question on diet from Mathur. Vegan diet excludes milk. What is your opinion about milk exclusion, especially in diabetic reversal, as advised many times?
So milk, fish, oil, coconut oil, all those things are something people's query. Uh, Milk currently, if you look at the American Heart Association recommendations, they'll say limit poultry and dairy product. And this is a very significant statement. Till now, they were not convinced that we should ever restrict. There's no problem in milk. Milk is, I mean, you get your proteins, you get your calciums. I mean, how on earth you will not let people take that milk? Milk and fish, omega-3 fatty acid, these two things are so much ingrained, but sorry, the eggs also. So there is a growing evidence to say that these at a level, there are studies, so they will start off with restrict dairy and poultry products, means evidence have started coming. For them to ban cigarettes took many years. Even after the first study showed that cigarette is precancerous, they didn't ban it immediately. But the fact that they have put a statement means that they have started looking at evidence to say, yes, there is evidence for which we need to at least restrict. So I see that as a positive movement in that for our patients, those who are prepared, we can help them to completely shift off. So there are a number of arguments for milk. I mean, we are the only species that take milk of some other species. Our needs and the species from which you are taking milk is very different. Uh, Saturated fat is there. You make your blood acidic, which moves most of the calcium from your bones. There are studies which shows there's increased calcium loss to the urine when you take that. So the number of those things are there. May not be very strongly established, but there are evidences that are slowly coming up in that area.
Lopat, last two questions. You asked of. Okay. Before that, well, before the last two questions, one comment I must say, and another question related to that. From the comment from Dr. Rajiv Kumar Thapar, good initiative. Surely, my submission is that Indian lifestyle, culture, and values are for a good panacea for lifestyle disorders. Surprisingly, we'll look for Harvard Western studies to get the confidence to follow. Kudos to CMC Velu for initiating the department itself. Well done, NNF, and so on and so on. So the question is, how can Indian lifestyle medicine be adapted to Indian cultural and dietary context for better acceptance?
So this is our responsibilities, and I think this is, we have to own it. And I guess as a president of NNF and having people across the country, you have a moral obligations to ensure that people who are in academic setups, you have to do your studies. And
Ours is a
our,
very small organization. Your Association of Physicians of India should be the one that should lead us, rather.
yeah,
Please
I
go ahead.
mean, so basically what we are saying is we are doing few studies right now. Some of them are community-based studies. We're also looking at how to control diabetes in the community. We have taken two centers, one in Jharkhand, another in Bihar, and two over here. We are looking at how do we train the the women entrepreneur who are the health workers to train them so that they can educate the people whose house they visit and monitor those parameters and adjust those medications under medical supervisions, and through lifestyle in a community based approach bring down their medications and improve their glycemic control. So when we were planning to do this study, we asked them, he says, lifestyle, no, lifestyle doesn't work in rural community. I said, why? Sir, they can hardly eat 2 meals a day. What lifestyle are you talking about? So when we say lifestyle, they're thinking that we'll ask them to take fruits and vegetables and broccolis and spinach and all those things. So the challenge for us is, how do you modify or plan your diet which is absolutely contextualized, culturally contextualized, and financially affordable? That's where our challenge comes. We don't have to do anything fancy. We have to look what is available and see how, if we design it well for that community, that is able to reverse those disease and bring back the health for that. This is a complete challenge for us. So there's nothing Western that you can bring and feed them. I mean, that is good to show in pictures and all, not in reality. Where do they get all those things, fancy things that we talk about? So answering to your question is, it is responsibility for each one of us, and you have to figure out ways that the concepts and the ideals that we have, how do you translate that into practice in your context that you're there. So where the rubber meets the road is what we are essentially talking about. So I mean, at this, I just want to say that, I mean, um, Manoj, Pooja, and the entire NNF executives, the fact that you are having a webinar on lifestyle and the number of people that I see have joined in, that's the big thing. So kudos to you guys for having initiated that and taking it forward. Our doctors are sick and they need help, seriously. Once they experience the health in their lives, they will definitely take it to their patients. So we are basically, that's the reality that we are living in.
Lopa, you want to ask one more? Or
I think last one question.
final two questions. Yeah. You ask one, I'll ask one.
Okay. So one interesting question from Radhika R. Does fructose from fruits get converted to fat and increase adiposity?
So when we're talking about sugars, we are basically talking about, is sugars bad? In one sense, you'll say, okay, sugars is bad, then why do we ask people to take fruits, so much of fruits that also has sugars? So it's very important in what package you're talking about. The latest study that was published by Dr. Anup Mishra from Delhi, he was talking about, they compared mangoes with bread. Imagine, what do you think will cause high sugars after the consumptions? And it was very interesting that it's a white bread whose sugar spike was higher than the mangoes. They also cautioned that doesn't mean that every diabetic starts eating any amount of mangoes. But you see, the sugar which is there packaged in its natural form in that fruit is much better than the one when you isolate, process the sugars, take it out, and then take it. That's where the problem comes. The same is with fructose. So that perspective is what we are saying is, if you want to understand diet in the simplest way, take things as it is in nature and its natural packing. You can be assured that that is safe and healthy for us. Anything that is taken out of it and processed, it loses its health benefit.
All right, I think we have already half an hour past our scheduled time. So last question, sir. What one piece of advice would you give doctors here today to improve their own health and start tomorrow?
Contact Manoj and Pooja.
No.
So I think the key thing that we always talk about is the SMART goal. And I think good to buy the book Atomic Habits. It's a very interesting book. So the key message is there. Atomic means small, habit means consistency. Start something small. Don't make too many goals. Just make one goal, maybe a dietary goal, and just do that for a good period of time till you're very comfortable and that has become a habit. Then add on the next one to that, and then next on the next one. So we need to be a little conscious, systematic, and structured when we begin a journey. Let's not get too hyper, too enthusiastic, buy big dumbbells and open a gym and start doing that. You wouldn't be able to sustain it. So very important is small but consistent. If you just use those two basic concepts, most likely you have begun the right journey and you will be able to sustain it over a longer period of time.
There are many more questions, but as Sir was saying, it will be difficult to answer everyone. So in advance, I apologize for if at all you had a query and it was not answered today. There are 2-3 ways how it can be answered. You can email the question to NNF it shall be answered. That is one way. Otherwise, join the group if you are not joined the Healthy Longevity Initiative. How to join has been the link, Google form to join has been widely circulated. If anybody has not received, please contact me, any of us whom you see on the screen here, or the NNF office. They will be happy to help you. And thirdly, we are having various various programs, thankfully in association with the Department of Lifestyle Medicine, CMC Villa. We are having organized lectures in the coming months. So we would be able to, hopefully we'll be able to answer all your questions. So stay tuned. So again, yes, sir.
Just wanted to add on that the answers will be given in the next monthly seminar, so that, I mean, that's only motivations for people to join in for the next, just in the lighter note. But I would, and this is what I told Manoj, you may have liked my talk, and I call this as a pep talk. You'll hear it. The half-life of this may be 24 to 48 hours, and after that you'll be back to normal. So these talks and all, they don't last too long. So I said that if you are really serious about it, then we'll begin a process where you begin with your own evaluations, and we can share some of those questionnaires for you to do, and give you some tips of how to set smart goals, and begin and make small groups within the bigger group, and kind of encourage each other, mentor each other, and begin that journey, because this is a long journey. And if you are convinced, you are committed, then the best way is have a partner, a group, or one person, and begin that journey. And knowledge will be added on over a period of time. There are lots of things to be talked about. Even if I answered all of them, most likely you may not remember everything that we talked about. So it's good to have just a bite size, focus on one thing, do that well, and keep adding on to the rest. But you can get the answers for all of it if you just search it. I am sure you can get it, so that should not be a problem. But I think, I mean, in conclusions, I would just say that I really commend the NNF for really come up in such a big number. I'm sure it's the charisma of Manoj and Pooja that has been able to draw all of you together. But now that you have come and you are really serious about it, when you start crossing a particular age, then everything else becomes secondary, and to take care of yourselves should become primary by this time now. If you are young, you may not give it much importance. Those who are crossing 50s and all, this becomes very important, because you don't want to become dependent on anyone, and you would love to be independent on your own, taking care of yourselves and not being taken care by someone. And if that is the main motivations, then it is good and it makes sense to start investing in your own personal health, so that you can really enjoy the latter part of your life in the most beautiful way.
Yes, sir. Let us all pledge to age with grace. Before I hand over to our master ceremony, Dr. Sharanya, for the closing remarks, let me make a housekeeping announcement. We have two challenges coming up. The first one is a daily 5 kilometer walking challenge. You have to wear a smartwatch and then record and post in the group. That starts 2 days later on 12th. So those of you are still not aware of it, please again contact us through any of those means. Or if you're already in the HLI participants group, then well, definitely you will be pinged at every stage. So before I hand over to Dr. Sharanya, let me thank my co-moderator, Dr. Lopa, and the chief guest and faculty, Dr. Sam, for making this a wonderful evening. Thank you. Thank you, everyone. Over to you, Sharanya.
Thank you, everyone. Thank you, Professor Samuel. It was a really eye-opening talk, and the examples about the malaria and all that you gave was truly eye-opening. And I think we can use these examples even in our day-to-day practice when we talk to our patients and parents. And I would like to thank all the faculty who made it to today's inaugural webinar. And like Professor also noted many times during his talk, the participation has been really good. So we crossed 100. It was 113 at the peak. And to be honest, most of the academic webinars also, we do not get so much participation. So we're really happy that, there's been a huge response, and we hope that it stays like that for our other webinars as well. So thank you all for joining us today, and we expect to see a huge crowd for our next webinar as well. Thank you.
Thank you. Thank you. Thank you, Sam sir. Thank you. Good night.
Good night, sir.
Good night.